Why do surgeons stand for surgery? Same reason you stand up to cook. Most surgeons stay the entire length of the case. There aren't a lot of super long surgeries anymore. 24 HRS of anesthesia in a row isn't great for you. Surgeons can trade off with another surgeon, but that is pretty uncommon. I know of one neurosurgeon who uses a wheelchair normally. I think she has a special lift set up to use while operating. The surgery table only goes so far down, plus many times there are multiple people and machines of different heights helping the surgeon, so it's better to just keep it the same through the case. Surgeon's PA, surg tech, x-ray machine, etc. fill the room. I've seen doctors work on multiple-hour cases without leaving or sitting down any, but I'm also sure it depends on their workflow. There are many reasons for standing. The operating bed only goes down so low. Beds are tilted head up, feet down, etc. Patients positioned in lots of different ways. The surgeon needs the physicality of being on their feet to use hammers or pull babies out, etc. Having said that, many surgeries are done sitting down, such as when patients are in lithotomy, legs in stirrups, or hand-arm surgery as the limb is placed on a side table. Surgeons do take breaks if surgery is particularly long. I worked with one surgeon who would sit and think about his next steps partway through the surgery, which was agonizing for everyone else as he was agonizingly slow, as it was. Simple truth is you get used to standing for a long time. I've done 10 hours straight, and it wasn't until I got unscrubbed that my body let me know my bladder was full and I was starving. Your mind simple tunes things out. I'm a little concerned that you seem to just be happening on random surgeries in your normal day-to-day life. Tough to answer your question. It's because you need to lean over someone to get in there right, and that just doesn't work while seated. I don't work in surgery, but have done some work experience and am working in a different area of healthcare. But to kinda summarize my own anecdotal experience, surgeons do get to sit. They have stools that roll and can move in and out without breaking the sterile field. This is often dependent on the type of surgery being done and the surgeon's preferences. Standing often gives you a better visual. For example, if you are sitting at a desk and you are putting a puzzle together, it's easier to stand and look at the puzzle as a whole when you do it. As far as I've seen, multi-hour surgeries are generally very complex, and the most senior surgeons want to be present for the entire case. They don't take breaks or tap out for the duration of the surgery unless medically warranted. Some surgeons will do the most complex component of the surgery and their juniors will do the closing, etc. So not all surgeries are done standing. Hand surgeries tend to be done sitting down, as well as rectal surgeries with the patients in stirrups, as well as ophthalmic surgeries like cataract removals. As far as surgeon switching off with another, it generally doesn't happen much. At some major surgeries you may bring in another surgeon to help if part of the surgery isn't your specialty as a surgeon. A surgeon may leave the surgery early to go write a report if the surgery is done and they have a trusted first assistant to close the surgical site and dress it too. Source: surgical tech for 10 years. My surgeon sat down when doing my knee. I asked him about it. He had to cradle my whole leg between his torso arms to drill into my bones to attach the cadaver tendon. I wanted a visual afterwards. He delivered. Honestly surprised that no one else has said this. Plenty of surgeons sit for a lot of different surgeries. A lot of cases require you to stand and a lot require you to sit, and others require you to alternate. I've considered getting a lower body exoskeleton chair thingy. General surgeon here. There is a big push for minimally invasive surgery and surgeon ergonomics. One of my mentors is disabled from chronic neck issues. There is a wonderful piece of technology called the Da Vinci robot where we sit to do the critical portions of surgery. This has saved my neck, back, and hands, especially on morbidly obese patients. Hand surgeons and podiatrists do a fair amount of their operation sitting. Try hammering in a cementless cup sitting down. Foot and ankle and hand usually sit. This question reminds me of the Seinfeld episode where George buys the security guard a chair. Better field of view, easier to reach, and less sterilization issues. Usually don't trade off with another surgeon, unless it's a resident or just another colleague, being trained in a particular procedure. But then the main doc will still stay over and observe every step. And yes, it's painful. The worst one I attended personally was a 17-hour-long neurosurgery, and by the end of it I thought my feet would fall off. You get used to it though. Also have to be very careful about your footwear. There is a reason everybody wears sneakers, even with business-style suits in the hospital. Not just reach, but sterility is a significant factor. It's harder to stay sterile sitting down and far more likely that you'll contaminate yourself accidentally, particularly because anything below your waist isn't considered sterile. TJ, a trope used in movies and shows.